in a really broad sense, the hope and the objective for today is to introduce, what pulleys are, how we injure them, how we protect them after we injure them, and then we're going to address really what are the root causes and what are the things that we need to be thinking about as climbers so that we can avoid and prevent pulley injuries. I'm joined today by Dr. Winston Warme, who is part of the University of Washington Department of Orthopedics and Sports Medicine, skilled physician and skilled rock climber as well, and he has created a device that is invaluable for someone who has a sprained pulley. I'm also joined by Shannon Russell, who is physical therapist at Union Physical Therapy, and also has a deep background in rock climbing as a youth athlete, somebody who's sprained a couple of pulleys and put a lot of reps on her body in the sport. Myself, I'm Mitch Owens. I'm co-founder of Union Physical Therapy in Seattle. We have a specialty program that is directed at managing climbing injuries. We've been doing research and developing treatment and prevention strategies for rock climbers over the last 8 years or so. And myself, with some background in rock climbing as well. Myself and the team here, we've put together these virtual workshops to try to spread some of the information that we're learning that we found to be just really simple, practical advice that climbers can implement into their training programs and then into their rehab programs if they do become injured. So, our mission here is really to educate the community and help people get out and climb longer and climb stronger. So, with that, I will pass the mic to Dr. Warme, and he'll be starting off our talk today. So thank you very much.
Thank you, Mitch, for that introduction, and great to be with Shannon as well today. We're going to talk about pulley injuries and rock climbers, as Mitch has said, and discuss some of the anatomy and how it happens and how to prevent it. So welcome to this virtual meeting. As Mitch said, I work at the University of Washington, and I'm a professor there, and do a lot of shoulder and elbow surgery, some knee surgery. And I do have a disclaimer with this talk that some of the slides show cadaver hands, so if you're of the squeamish sort, you may want to close your eyes when you see those. If that doesn't bother you, that's good, but I think it's helpful to see the real anatomy and know what the heck we're talking about when we're talking about pulleys. Otherwise, we just think about a fishing pole. We don't really know what we're dealing with. So I've been climbing for a long time. I'm not a great climber like Mitch might have misled you to believe, but I've been doing it a long time, and I enjoy it. And so I'm climbing 3 days a week, usually at least, if I don't have other commitments. And I've been doing a lot of research with pulleys for a long time as well. And so I'm happy to share some pearls with you today, and we'll go through some stuff kind of briefly. One thing is, climbing is formerly been looked at as a fringe sport where, no one really does this except people that have a death wish. And, but it's become a little bit more mainstream with a lot of the climbing gyms, etc., that provide a safer way to potentially get into it than just going out to a crag somewhere and throwing yourself at a rock. So anyway, these things are popping up all over the place, of course, a little constrained by our current COVID pandemic. And lots of movies over the years have kind of highlighted climbing and made it perhaps a little more popular, especially the Dawn Wall and Free Solo movies that have won lots of awards for good reason. And anyway, climbing has become more and more acceptable. We were going to see climbing in the Olympics, but sadly the pandemic got in the way of that. But it's hit the mainstream, and it's become a lot more popular. And with that increased popularity, there's been more participation leading these competitions. And with those competitions come zealous training and professional climbers, pushing the limits of what's humanly possible on plastic as well as at the crag. So we don't know when we'll actually see our climbers in the Olympics, but that could be sometime soon. But what we do know is that the number of traumatic injuries like broken bones have decreased a fair bit with the pads, spotting, with bouldering, etc. But the numbers of overuse and overtraining injuries have flourished. And a lot of these are elbow tendonitis, shoulder tendonitis, bursitis, wrist tendonitis, and climber's finger, which is what we'll focus on a little bit today and talk a little bit about what that's all about. The term climber's finger has been used to describe what many climbers feel when they have an injury to their pulley or their tendon sheath. And so we're going to talk about what it is and why is it significant, how do we make the diagnosis, how do we treat it, and there'll be more on prevention.
You got to get this stuff. Okay, I have my own work to do. I'm just...
Mitch and Shannon, we're going to need everybody mute their mics if they're not talking. That will help us all out. Anyway, so when people say, I have a climber's finger, it doesn't mean that you're just a climber who has, 10 fingers. It's when you sustain an injury. And it's oftentimes that the pulley itself gets hurt. It can be used to describe a tendon injury, but the most common thing that happens is that the pulley gets injured. We're going to talk about the pulley and what they look like. And if you can imagine tendons running down through these tubes that you're seeing here, these are graphic representations about what the pulleys look like. They're not labeled the way we currently label them, but I thought this was a nice colorful picture, so I always like to show it. But anyway, the pulleys, their job is to keep the tendons right next to the bone so you have optimum amount of range of motion and strength in the hand. And when they get torn, there can be problems with both range of motion and pain, of course. Now, adolescents and teenagers, young teenagers or tweens are much less likely to get a pulley injury than adults. And the reason is their growth plates are the weak point. And they'll get what we call stress fractures at the growth plate. And you can see at the arrows down below there that those physes or open areas where the bone is actively growing are a little bit widened, and even a little step off on this little one here where it's actually cracked. So this is just from overtraining. This isn't from a particular injury necessarily. It's just reps, and lots of crimping really overloads this area, and it can have these problems. And here's just another example. And again, this young lady was climbing hard, as you can see, but just started training 5 days a week, and all of a sudden her finger said, time out. And that's what we saw on the x-ray. Another example of similarly aged young lady climbing really hard, and all of a sudden fingers started swelling, hurting too much to even pull on. So we can see these, and the good news about these, if it happened to one of your children, something like that, they get better with rest. All you got to do is shut them down, and that's not easy to shut these kids down because they're hardcore, but you just say, hey, you can do push-ups and you can go running as much as you want for the next 3 weeks. And usually that's really all it takes. In rare cases, we need to immobilize them, and even more rare cases, we have to do surgery, but almost, I would say, 99.5% people who get these stress fractures will get better if they do allow their fingers to rest. So that's the good news. So here's some gross pictures that you may want to blink your eyes, but this is what the Fibro-osseous sheath looks like, and this is where the hand is, and this is the finger coming down this way. And then there's the A1 pulley, A2 pulley, and then A4 pulley, which are the strongest pulleys, and they're the ones that climbers injure, and they're the ones we're going to focus our talk on today. And as I mentioned earlier, if you think about a fishing pole, it's kind of the way these work. They keep the tendons close to the bone, which increases the range of motion in the finger for a given contraction of a muscle. And these are just more pictures. and it's showing you how these pulleys increase the mechanical advantage of the tendons. And all the muscles that run those tendons that we're talking about, those are the flexor digitorum longus and flexor digitorum profundus tendons, the finger flexors. Those muscles are up in your forearm, and that's why your forearm gets pumped when you're trying to hang on the rock. Okay, so when did we first figure out that these pulleys could get injured? It really wasn't until 1990 that we got 2 reports of closed pulley injuries. Closed meaning the skin was never injured, and the pulleys popped for climbers. And one of these was written from France, and another author was from the UK, and they both kind of wrote this up at the same time. If we fast forward about 15 years, this has become one of the most common injuries reported in expert rock climbers, and you don't have to be an expert to get it. But even in elite climbers at a competition, when they were examined, 26% of them had evidence of pulley injury. So it's quite common, and we're going to talk a little bit about prevention later on in this talk. But just again to familiarize you with the pulleys, the one that is really important to think about here is the 8-2 pulley. It's right over the first digit, if you will, on the palm side, holds the tendon in there, and then over the second digit of your finger is this A4 pulley, which is also super important. These pulleys they're really strong, but we put a lot of force through them when we're climbing, especially when we're using the crimp grip. So there are lots of other pulleys, and I don't want to say they're not important, but they're not as important as the A2 and A4 pulleys. Those are the critical pulleys, and they're the strongest pulleys, and I'll show you some slides that explain that. This is one of those slides. This is the force that the pulleys can withstand before they break, and you can see the A2 is a really strong pulley. And the A4 is also pretty strong. The A1 here looks really important and strong, but it never gets injured in climbers, so we really don't need to talk about it very much. So the A2 and the A4 are really the key kingpins, if you will, to tendon stability in the finger. You can look down here quickly at the A5 and A3 pulleys. They are really wimpy in comparison. So they all work together, but the A2 and the A4 are the ones that we want to really care for and protect. And if they do get injured, we want to do the right thing to get them healed. So these are more pictures. This is cadavers, again, where they injected India ink into the tendon sheath. And so the ink doesn't leak out. It's a continuous sheath, but parts of it are really thin, where you can see the pulley balloons out around here and balloons out. So those pulleys, they're not really rigid structures, but the A2 and the A4 pulleys, they are really rigid and strong structures. So that's why I think it's helpful to look at these and kind of understand what you're dealing with. The other pulleys are kind of stretchy in comparison. That's the A2 and the A4. And there we are looking at the anatomy in a little bit different configuration. Again, those 2 pulleys really holding those tendons right next to the bone. So why do climbers get this? Well, we use all kinds of grips when we're climbing, pinch grips, and we jam our hands into the rock. And we use underclings and open grips, which are much more protective in terms of not putting the tendons in a biomechanically disadvantaged situation. But these, when we start doing pocket climbing and especially crimping, we really are putting the tendon sheath at risk. And it's because the tendons want to pull straight down, and we're making it so that the pulleys are taking an awful lot of load. And you'll say, well, hold on, I've been climbing for lots of years. I know my fingers are stronger than the average person's finger, and that's absolutely true. And this MRI shows that the arrows are pointing at even the collateral ligaments on the fingers are about 2 or 3 times as thick as normal. The bone density is also thicker in climbers because we're putting lots of force through our fingers. And so we have a lot of anatomical adaptations. You can even see me. This is my A2 pulley on an uninjured finger, and that red line is going around the pulley there. And this pulley is about, I would say, 3 times thicker than a normal non-climber's hand. So it's protective, but not 100% protective. And like I say, when we crimp, especially, that's when we're putting the sheath at a high mechanical disadvantage. And if we have a foot pop off, then we can hear that telltale pop, which often means that there's a pulley injury. So here's an example graphically down below, someone in a crimp position. You load the tendons kind of suddenly, either with a dynamic move, trying to stick a dead point on a crimp, or trying to dynamically move quickly off a crimp, and you can have that force exceeding the biological strength of the pulley, and you can tear one pulley, in this case A2 pulley, or in this case all 3 pulleys. You can get the A4 pulley alone by trying to dead point to an open grip deal. Sometimes this happens when, again, a foot cuts loose and you have your finger in this kind of open grip configuration. You could just injure the A4. So what's the significance? Well, these hurt, and they take a long time to get better. You can lead to bowstring if you've had multiple injuries or multiple pulleys injured. Fingers can actually lose the ability to completely straighten out after these, and if you tear enough pulleys, you may need to have surgery. So they're significant. Here's an example that shows, how the tendons will move away from the bone. Here's an intact pulley. Here's a torn pulley, and the pulleys then, or the tendons, want to move away from the bone. Then every time you're bending your fingers, the pulleys the tendons want to move away from the bone. And down below here on the right, this is an example of bowstring where the tendon is no longer staying right next to the bone as it is here, but over here it's coming away, and you can actually feel it coming away from the finger. Usually, if you can feel it, there's more than one pulley injury.
He's a super nice guy.
So there's another example of that bowstring can happen. So most of the time, the history is important when someone's telling you their tale of woe, or you're asking the patient, how did this happen? They'll tell you, and often they'll feel a tearing sensation in their finger or a pop when they dynamically to or from a small crimp type or their foot pops off. So this is a friend of ours that may be well known to you or not, working on it.
This is Alex.
Benchmark. And did you hear that pop? I'm going to play it one more time.
I've never seen that.
Just watch its heel pops off and watch what happens. So as soon as his heel pops off, he really loads his left hand. You hear the telltale pop, and he is off the moon board and not having a happy face. So you can clinically diagnose these from the history, which is very clear in that video. On physical exam, when you see bowstringing like this, it's pretty obvious. Other tools are helpful. MRI here can show you how the tendons move away from the bone.
Did he see Dr. Warme?
This is long axis, and then this is another tool that we have is ultrasound. And ultrasound is actually the best way to get your pulley evaluated. If you think you've had a pulley injury, we have some good ultrasonographers in this town, and of course throughout the country there's good ultrasonographers worldwide. But you want to have a good ultrasonographer who knows how to look for these, and not everybody who knows how to turn on the ultrasound machine can actually get good images. But for example, the young man that injured that pulley, we got an ultrasound on him, and I think it's easiest to see here. This is an intact one side of the pulley. This is what we call a short axis view, and here the pulley is torn away from the bone. And you can see that over here as well. So the pulley is intact here, torn right here. On this view here, you can see that the tendon, this is the tendon, this grainy, wavy stuff, has moved away from the bone a lot. And this is more than it should be away from the bone at rest, and this is when he tried to tighten his grip, but it hurt too much to even tighten it very much. But that is an indication of a full pulley injury, just like the rest of those images. Well, anyway, we don't want to bore you with too many imaging studies. We just want to talk about now what can we do to manage these, and can we prevent them? And so we know as climbers, we love to tape things up, especially if we're climbing an Indian Creek or Vitavu. But does it work to prevent injuries? And when I got interested in pulleys, having sustained a pulley injury myself, I said, well, does tape work? So I designed a study to look at that a long time ago. And we got a bunch of cadaver hands and we taped them up. There's a gross picture how we identified the pulleys beforehand. And then we taped them up in this configuration so we could test an index finger tape versus an index finger untaped, and ring finger tape versus untaped. And we alternated the hands. We had pairs from the same cadaver. Okay, so we were, this was a pretty good study in terms of its design. And then we mounted these guys in a jig, and then we just pulled on the tendons and got the pulleys to rupture. And we just kind of watched how this happened, and we recorded the forces, and we actually filmed these with cameras and everything like that. And I'll just go through this quickly, not to bore you, but it can happen that you pop one pulley first. So in this case, the A3 pulley popped, and then the 3 and the 4 pulleys popped next, and then sometimes it would all 3 pulleys would pop at the same time. So that's true in real life. We can sometimes have a really bad injury where we can injure 3 pulleys at once. Sometimes just one or another. Anyway, make the whole long story short, we found that tape really didn't make any difference. It added maybe 6% to the pulley load to failure, which is insignificant. And so we found no difference between taped and untaped specimens in this cadaver study. Interestingly, we published that in like 2000, and then the same year, another author from Germany published the exact same findings. He did the same study, similarly, not exact same methods, but found the same thing. Essentially, it may have decreased bowstringing a little bit, only absorbed about 12% of the total force, which is not significant. And he summarized his findings from the study that taping is ineffective in preventing pulleys. So don't think that tape is going to prevent you from injuring a pulley, and especially if you're close on a project and your finger's hurting and you say, I'll just tape that thing up and I'm going to get that thing done. That is not a good plan. All right. So reasons that tape doesn't work: it stretches, the adhesive slips, sweat gets in the way. There's lots of reasons that tape doesn't work. There's no perfect tape, but the main reason it doesn't work is because of the anatomy. It's very hard to exert a force holding that tendon to the bone. I think those anatomical photographs showed it to you the best. And these, there's a lot of soft tissue. If you just take your finger like this and grab that skin or whatever that soft tissue is there between the palm of your finger and the tendon, there's a lot of stuff there. There's a lot of specialized soft tissue so that when you grab things, it doesn't hurt. And all that stuff, you can't compress all that stuff against your finger with tape without cutting off the circulation. You got little blood vessels in there, or you're going to go numb because there's little nerves in there. So, tape by itself doesn't work. And we've shown that, clearly in the lab.
So excited.
Here's a little video that kind of hopefully will also show you how it doesn't work. If you have 6 turns of tape here and you put it on a little dowel like I have here, and just put a carabiner on there, watch what happens with the tape. It just stretches right out. So it's really, it's just key to know there's no way that tape can resist a deforming load. All kinds of athletes use it. You see football players doing it. They're taping their cleats and their ankles and all this sort of stuff. It just really, a lot of it is placebo. So if you think a placebo is going to help you, then feel free to tape and use up as much tape as you want, but it's not going to prevent you from hurting a pulley. If you have a partial injury and your fingers are sore after you're climbing and you really one spot is sore, it's time to rest and let your body heal and concentrate on your core and pushing muscles, which maybe you're not working out. So I hope that kind of puts the hex on tape alone. Now, people are really infatuated with H-taping, which has become the rage. And, every time I go to the gym, I see people with H-tape all over their fingers. I've tried it. It does feel like it's very, very supportive. So what do we want to say about H-tape? Well, it's popular. It's been recommended by experts who've written books about climbing, and you may have read some of these books. And you might think, wow, this is a good idea. This is the best thing we can do with tape. Well, it's a great idea, I would say. It does feel good, but does it work? That's the bottom line. How are you supposed to put it on? You're supposed to put it on with your finger bent 60 degrees, and it's designed to support the A3 pulley. This is all information from Dr. Schaffel's paper. And so you remember earlier in the talk, we mentioned the A3 pulley is really not that strong a pulley to start off with. So, the fact that this tape may support the A3 pulley, to me, already doesn't make a lot of sense. So in their study, they were able to show that it decreased the movement of the tendon away from the bone by about 16%. And that was obviously at time zero. That was, they just taped the finger, tested it, and it showed that it decreased what we call the tendon pulley distance. This is how they tested it, and they were able to show, again, that 16% decrease. Well, here's what I want you to think of. If you put an item on your finger at 60 degrees of flexion, what happens when you go into the crimp position, which is when you really crank your finger up? So I put a Band-Aid on here just to show you it's 60 degrees, and when you bend it up to 100 degrees, what happens? It gets loose. They just crash. So how could it possibly support the pulley when you bend your finger up? It doesn't really make any sense. So I just can't really get excited about it. I had one of my former fellows did a study on this down in New Mexico with a bunch of cadavers and ripped them up and did the same thing. And their summary statement was that they can't support H-taping as a prophylactic or temporary fixation measure against A2 pulley injury. So, sounds good, feels good on your finger, not doing anything. Don't recommend it. So, there you go. Again, just reminding you of the force requirements. Remember that A3 pulley that is designed to protect, that pulley is a nothing burger. So, really can't support the use of H-tape. It stretches when we use it, and even in the initial article, Dr. Schaffel said it needs to be reapplied after every burn on a boulder problem or every year. So, I mean, that's not realistic. I don't think any of us want to try to tape our calf every time we try. How long? So not feasible, not realistic. If tape doesn't work, what can we use? Well, there are, for example, for acute injuries, Dr. Schaffel came up with these pulley splints that you can wear to get the pulley to heal, and we're very positive on these. These make sense to us. Dr. Schneeberger came up with his pulley protection splint that also can work. Things that I'm not keen about these particular splints is they're kind of bulky, not very comfortable, and climbers are not going to wear them very long because they're bulky and not comfortable. So they also say that, after you wear them, then you protect with tape and go back to climbing. And I would say you can't protect the finger with tape. You can go back to climbing when you're pain-free and you've given it 8 weeks to heal up. We'll talk more about that. Anyway, there's some problems with conventional wisdom. Tape doesn't protect anything but skin. And the main thing, everybody who's tuning into this talk knows that climbers are going to go back to climbing as soon as their finger feels better. So we know that. So I devised a sport, which is a splint for the climbers that you can wear climbing. So as you're getting back into climbing, it'll support your fingers. And this is our website. You can go on, learn more about it, and actually get one of these kits if you need one. Hopefully never hurt your pulleys. But if you do, it's a semilunar pulley orthosis. You make it customized for your finger. We give you all the instructions on how to do it, and it works really good. So it's a climber-friendly way to treat A2 and A4 pulley injuries that happen. That's me climbing and my son climbing. Both of us, sadly, have had pulley injuries. It's designed to be used when climbing. That's the kit, what it looks like. You put it on securely with tape to close the ring down and hold it closed. And it doesn't really get in your way climbing unless you're crack climbing. But if you're sport climbing, it's relatively not bothersome at all. That's x-rays with them on, showing them supporting the A2 and the A4 regions. This kind of just highlights how we want to support the A2 pulley, and the support on the correct way will support that area as well as the C1 pulley, and then I'll show you another one later. This is how the support works. It basically closes down the ring. It pulls those pulleys back up together and the tendons back to the bone. And diagrammatically, you can see this is the tendon pulley distance here. That is decreased dramatically by wearing a support. And we've done ultrasound studies that show that. This is an example of it. So this is my finger with a chronic pulley injury, and my tendon pulley distance here is over 4 millimeters, 4.2 millimeters without the support attached. And when I put the support on it and tape it on appropriately, it goes down to about 2.7 millimeters. So that's a pretty significant reduction. It's 36% closer to the bone and 47% closer to the normal location. Because a lot of times when you check the other finger, there is a little bit of increased tendon pulley distance in people who've been climbing for a long period of time, but it's not in the 4 millimeter range where you have a full pulley injury. And what we did to validate the sport was actually we got a bunch of climbers who thought they had pulley injuries. We ultrasounded them, and then we put the sport on them, and then we ultrasounded them again through a window in the sport, and we were able to show that it decreased the tendon pulley distance by 26% and reduced the tendons back about halfway back to where they belong, which is amazing in a chronic situation, because what happens in a chronic situation is the body throws a lot of scar tissue down in that area to kind of fill that gap. So to be able to pull it down 50% was amazing. The goal, of course, is to treat an acute pulley injury right away and get that tendon right back against the bone. And we've been able to show that that works as well. You can also work with A4 pulley injuries, which are more rare than the A2 pulley injuries, but they certainly occur. And a smaller sport will work there too, as you see here. It's kind of highlighting how it's supporting that area as well as part of the C2 pulley. So I guess I want to close by saying climbers' fingers are common. They will respond to rest, but the pulleys will heal in a stretched out position unless they're treated properly. If you feel that big pop, you want to get this evaluated and treated quickly. You can get an ultrasound, see people that know how to get those done, and I'm sure the folks at Union PT can certainly point you in the right direction. You got to climb smart, though, and so what I'd like all climbers to be doing is training with open grip as much as they can, and not automatically going to a crimp, because it's a lot harder on your pulleys and it's a lot harder on your cartilage in your finger joints. So train yourself to use an open grip as much as possible. When you're campus boarding, moon boarding, system boarding, or arcing, climb smart. And if you have a painful finger, I would say that's a good time to rest and take a couple weeks off. If you have an acute pulley injury, these will work well and get them to heal. And I think we have some people on the call today that may back that up. This is my son Connor, had an A2 pulley injury, and we treated him with the sport. And he got back to doing some arc training at 2 to 3 weeks, focusing on other stuff besides his finger. And then he wore the sport when he was climbing for the second 8 weeks, returning to climbing slowly. And then just for research purposes, we got an MRI of him a little later down the road, and my friend, a musculoskeletal radiologist, couldn't see anything wrong with his finger. There's just no sign of any injury. His pulley healed perfectly. So it can work on an acute situation, and you gotta wear the sport for a full 8 weeks after the injury when you're at work all the time.
About 15 minutes of talking.
It's also helpful for chronic injuries like me. I had a chronic injury. I showed you my
Yeah, I was just gonna say I can rip through my stuff.
ultrasounds before, and if I go climbing for a couple hours, it'll hurt for a couple days afterwards without the sport. When I wear the sport when I'm training, my fingers never get sore the next day. So I like it for that reason. I don't like having sore fingers. So in this study, again, we were able to reduce the tendons back to the bone by 50%. And it just makes so you don't get tendonitis in your fingers, and your fingers are more comfortable. So happy fingers, happy climbers. So you can use it for acute pulley injuries, chronic pulley injuries. If you get tendonitis in your fingers, a lot of times this will help. But in terms of prevention, things I like to focus on, and Mitch and Shannon have other tips for you, is always warm up properly with at least 100 moves. Be super careful dynamically moving to or from a crimp. Never crimp on a mono, and always use an open grip with pockets. So those are some things that will hopefully protect your pulleys going forward. You want to keep a really strong core too, so you keep your feet on. We get lots of trouble when our feet pop and we overload those pulleys. And again, can't emphasize training with open grip
those animals
enough.
down in your stomach.
Right? That's all I've got.
I'll turn the mic
Thanks
on
for
now.
listening.
Thank you very much, Dr. Warme. I think what we're going to do is we'll hold questions till the end.
Okay.
And we're just going to lean back on the throttle and get through our end of the talk here, and make sure we leave about 5 minutes for questions at the end. If there are further questions after the talk, they can be directed to our admin at unionpt.com email, and we can kind of push those around in the email chain as well. So I love that talk. This is the second time I've gotten to see you do it, and I think it's something anybody who's either had a hand injury or is trying to rehab hand injuries should see. And dispelling the myth of tape is huge. I find your the carabiner and the Band-Aid examples just to be absolutely crushing for those theories, and I think that's a good thing to do. So with that, Dr. Warme, if you don't mind turning off your screen share, I'm going to grab a hold of the screen here, and we'll go ahead to move into our presentation. And should just be a moment if I can find the right button. Things are moved around on me. There we go. Okay, so Dr. Warme's done a great job of setting us up for building an understanding of the anatomy, the force dynamics behind the injury events and how that occurs. We want to set the scene for kind of the zoomed out view of what is influencing pulley injuries, and why are not all climbers whose feet cut while they're holding a crimp, or who are dynoing off of crimps, why are some people able to do that without injuring their fingers, and why are others unable to do that, and why do these injuries, what might be behind some of these injuries? And we have some theories on this based on observations that we've made here in the clinic with experience treating these injuries and treating the whole person up the chain from that pulley injury. So with that, we'll kind of just quickly breeze through some of the information that Dr. Warme has already highlighted. When we're looking at the anatomy, we talked about finger flexor tendons, right? And so where do they come from? Well, they come from up in the forearm. They come from the long finger flexors, your flexor digitorum, superficialis, and profundus. And those tendons, they travel a long distance from the forearm to get through those pulleys and into the fingers. Okay, they have a certain contribution to grip. It's always, it's a heavily used area in climbing. We feel pump in our forearms for the most part with climbing, unless we're talking about hand jams and other things like that, where you'll actually feel fatigue in the hand itself. So the other part of so then again, just those tendons, traveling through those pulleys that long distance from the forearm to get down to the end of the finger. The other part of grip that is significant, so the intrinsic hand muscles, okay, the ones that help to position and stabilize the bones and the soft tissues of the hand, are called the intrinsic muscles, and they live basically from the wrist down. These intrinsic muscles are about 38 to 70% of this key pinch grip, but in other versions of grip, they're about 40%. So the muscles from the wrist down, even though they don't pump out in the same way that the ones in your forearm do, they're an essential part of grip and an essential part of your grip in climbing. And just think about that load sharing between, 40%, let's say, and then the other 60 here. And we want to present, how that's going to impact load on the pulleys. When we're talking about load on the pulleys, and we talk about open and closed crimp positions, Dr. Warme does a really nice job of demonstrating, okay, what these pulleys can handle. Well, what are we giving these pulleys in terms of load in these different positions? This study looked at open crimp position or open hand position versus a closed crimp position. And in this open position, you can see that in this area here, we have about 8 newtons of force on that A2 pulley. If we come up here into the closed crimp with the same amount of load on the fingertip, right? This is 97 newtons pulling up on the finger. This is roughly the same amount pulling up on the finger. We get 254 newtons. So it's either 8 or 250, totally determined based on where the hand is positioned. So definitely, a strong, that supports, this open hand training position, especially when somebody's returning to climbing after a finger injury. So, those are the implications for coaches and for climbers. When we look at, why do these injuries occur, just to review that really quickly, it's this dynamic overload. It's shock loading of this system when a foot cuts, or, we're dynoing off of a crimp. And we know from building anchors that when something gets shock loaded, it can't resist the same amount of force as if it's loaded in a steady, even manner. Basically, those are the things that in some cases aren't preventable, right? So you can't necessarily predict that your foot's going to cut. What are the things that we can control? This balance between the muscles in the hand and the long finger flexors that travel through and load the pulleys is something that we can manage and we can set up preventatively. And so what we have found is that there is a strong association between inhibition or weakness in the intrinsic grip muscles that are below the wrist and the long finger flexors, which are coming from the forearm, in people that have either active injuries to their pulleys or are predisposed to future pulley injuries. This imbalance between your intrinsic muscles and your long finger flexors, right? So the finger flexors that are flexing these parts of the hand versus this part of the hand are where that imbalance occurs and how you end up overloading the pulley. So why does this happen? Well, climbing has its very specific, sport-specific adaptation, right? So if you're climbing a lot, you are going to develop a lot of strength in your ability to pull back and down and then back with the rotator cuff. Okay, so this is the pattern of dominance that we see in the shoulder girdle, and this is the pattern of weakness that we see pressing forward and up and then down and forward through the rotator cuff. Okay, so this pattern here, what it can do is if you fan those flames enough and you're training at high volumes under high loads, so you're a competitive climber, you're somebody who's pushing yourself in the sport, you can end up giving yourself a subtle version of thoracic outlet syndrome. And what that involves is compression of the nerves as they're coming under the collarbone or under some of the musculature that creates the borders of this zone. And what that results in is weakness in the intrinsic hand muscles. And this is an extreme example of that, but that kind of looks like a crimp grip, right? So as these muscles go away, we start to then totally rely on our long finger flexors. Good. And so that's where this overload or imbalance scenario occurs. And this is something we observe in climbers all the time, whether it's elbow complaints, a pulley injury, a shoulder complaint. And this is one of the big things that we're trying to get out. This is one of the big messages we're trying to get out today is that, hey, let's not train and overtrain in such a one-sided way that we're going to end up with these nerve compression syndromes. And that is certainly preventable. And so how do we do that? We do that by strengthening the antagonist muscles to our pulling and climbing muscles, right? And so, here's a long list of muscles that we should be thinking about strengthening. Basically, that can be just summed up very quickly by going to by the unionpt.com website and checking out our climbers injury prevention program on there. We have a bunch of information there on antagonist training. We have YouTube videos on antagonist training that you can check out. It is really, really simple to just spend about 10 or 15 minutes after you climb, making sure that you are strengthening the muscles that are antagonistic or oppositional to the muscles that you just use in your climbing session. Okay, so as far as managing a pulley injury, I kind of have been cruising past this part because I think Dr. Warme does a nice job of breaking that down in his talk. Obviously, in the beginning stages, we need to protect the pulley. We don't want to be climbing on a painful finger because we know we're stressing that tissue. We also know that, well, even though you sprained it, it's not necessarily going to hurt in those first few weeks where you still need to be protecting it. So if you have a painful finger and it came on with a pop or even without a pop, but you had a period of finger pain, don't just try to climb through it. Make sure that you're bracing and supporting the thing. I mean, the sport is a very inexpensive device. It's very easy to apply, and you will thank yourself later when you're not dealing with chronic finger issues that impact your climbing, or your hand function when you're 70 years old. I think of I forget who the climber was, but there was a famous Yosemite climber who was interviewed, and he was asked, about all these amazing feats that he did in Yosemite and all of his exploits. And they asked him, say, hey, if you could have done one thing or you could have one thing back in your life, after all these great experiences, what would it be? And he said, I wish I could have my hands back. He's now 70 years old or 60 years old, and his hands were terribly arthritic. And, that has big downstream implications. And we're trying to get this information out there to prevent youth climbers from getting into that boat, getting started at a young age. So I'm going to cruise past some of this management stuff. There's some very interesting information out there about how to utilize hangboarding to rebuild the capacity of your finger flexor tendons, referencing Esther Smith's podcast on training beta. Esther Smith's a PT out of Utah who I really admire the work that she's doing, and I think this hangboarding program has been successful in managing chronic issues. And so what I'm doing here is kind of cruising by that information so that we can highlight some of the information that we're out trying to gather in the community on these patterns and how these patterns of muscle inhibition and muscle imbalance are showing up for us in the community and in some of the folks that are setting the routes for us out there. So with that, I'm going to pass the mic to Shannon here, who will lead us through that.
So my part of this will kind of just be building off of what both Dr. Warme and Mitch have already talked about, and seeing what that pattern looks like in climbers in our area. And especially, so I looked at route setters this summer that are setting in our local gyms, and they're climbing, they have an average of 15 years of experience, and they've been setting a long time, and they climb 2 days a week just for fun, and then they're setting 2 days a week roughly on average. So we wanted to look at this population because they're the volume of work that they do and how much they have to rely on their bodies for that, and seeing what their presentation of where we can find weaknesses and strengths and how that can play into what injuries they have had or currently have. So this is just a kind of a brief overview of asking them what injuries they've had in the past or currently are dealing with. And you can see for all of these injuries, at least half of them have experienced it from anywhere from neck pain, shoulder pain, elbow pain, all the way down to pulley injuries. And you can also see that half of these setters had shoulder, elbow, and finger injuries all on the same side, and typically on their dominant arm, the arm they're using with their drill to put the holds on the wall, and also they are all right-handed dominant anyways. And after kind of screening them for the injuries they've had, we took them through a screening as if what we would do in clinic, kind of running through what their strengths and range of motion and all of that. And the percentages on the side are how many of them have had these impairments. So it's a very similar pattern to what Mitch has already talked about. Climbers are strong in that pulling down and back, not so much in that pushing up and away. So we saw a lot of strength deficits kind of with their arms overhead, which that's really important for climbing and setting. You need to be strong in this position. So we're seeing a lot of them with weakness pulling down in this position, as well as being pretty limited in how far they can move their arm when they're up in this zone. We also saw a lot of increased stress across the front of the shoulder. As they're moving their arms overhead, they're getting a lot of compression in the front of their shoulder, kind of where all those nerves that we're talking about are traveling out of your neck down into the arm. And then the scapular weakness are the muscles that kind of oppose all of that. So all of the muscles that are helping balance you out a little bit in stabilizing your shoulder blade as you're reaching up overhead. And every single one of them had significant weakness in lower trap, middle trap, serratus, some of the muscles that were listed in Mitch's slides. And those are all pretty easy muscles to strengthen. They're just not the ones that we get at with climbing alone or a lot of climbing specific training. And then the other big thing is Mitch has talked a lot about that intrinsic hand muscle strength. We like to test climbers down low with their arms at their side and then their arms up above. In this position, you're getting kind of a little bit more compression from the nerves, and every single one of the route setters was very weak in this position and stronger down at their side. So all of that is to say it's really reinforcing the same injury pattern that we're seeing and seeing downstream effects of people with shoulder and elbow and wrist pain and then ending up with pulley injuries, is that we can manage that injury. We can manage these upstream effects or upstream weaknesses that may have contributed to why they got that pulley injury in the first place. So it's a relatively simple fix for a very consistently presenting problem with climbers. We can do simple strengthening, we can find those weaknesses, get on top of them early so that we don't see those pulley injuries down the line, especially with kids are getting into the sport younger and younger. We've got more and more people involved in the sport, and we're trying to get this information out there to try and shape the training as climbing moves forward so we can prevent these injuries. And kind of looking at what training volumes look like. What do we need to do to balance out all of your climbing time and all of that strengthening and that normal pulling down and back pattern so that you can get the opposite strength in there as well. And that comes in the form of, having days where the focus is on the climbing specific training and days that are focused more on balancing you out a little bit. And we like to put that we are only as strong as our weakest link, in that you can be super, super strong at climbing and all of that pulling down and back, but it only takes one part along that that whole chain have weakness there that can kind of send you down the road of injury. So on our website, the unionpt.com, there is that climbing project part of the website that has a whole bunch of exercises that you can take yourself through. And we also treat this a lot in our clinic, so it's something that we're always happy to kind of talk climbers through and work through with kids all the way through adults that are climbing. Do you have any final words on that?
Yeah, I think with that, we will open things up to questions. And, the easiest format usually for that is to take advantage of the chat feature. I'm going to go ahead and just quickly do something on my end before we start firing away on the questions.